it's hard to tell them apart unless you treat the sleep.
Pediatric neurologist Dr. Jose Colon says sleeping disorders and behavioral problems can have very similar side effects, especially for children.
They very much intertwine because disrupted sleep can give you daytime ADHD symptoms.
Director of Lee Memorial Sleep Disorder Center, Jim Hill, says the side effects of a sleeping disorder for a child are opposite from what an adult would experience.
Normally, if you're sleeping poorly and you're suffering from a debt fatigue, you get very lethargic and you just don't do much because you're tired. It's just the opposite with pediatric patients. With kids, if they're dealing with a debt fatigue, they get hyperactive.
Experts say these are some of the symptoms of a sleeping disorder: fidgety, hyperactive, and behavioral problems. And these are some of the symptoms of ADHD in children, two disorders with almost matching symptoms.
So oftentimes, doctors will perform a sleep study on the patient to determine what's causing the child's symptoms.
And we do a test and we find a sleep disorder. Once you treat it, if the symptoms go away, then it could have been ADHD secondary to poor sleep. Now, if the symptoms improve, but there still are some ADHD symptoms, then they may have a touch of both.
The child's treatment will depend on the results of the sleep study. For Lee Memorial Health System, I'm Lindsay Fry.